Tetanus is a serious but preventable bacterial disease that affects the nervous system. It is caused by a bacterium called Clostridium tetani, which produces a powerful toxin. This toxin attacks the nerves that control muscles, leading to painful muscle stiffness and spasms. Because it often causes tightness in the jaw muscles, tetanus is commonly known as lockjaw. It is not spread from person to person. Instead, infection occurs when bacterial spores enter the body through wounds or cuts. Causes of tetanus. Tetanus bacteria are commonly found in soil, dust, and animal manure. The spores can survive in harsh conditions for a long time. Infection usually happens when these spores enter the body through deep cuts or puncture wounds, burns, or surgical wounds, animal bites. Injuries from rusty nails or contaminated objects. Unclean childbirth practices in newborns. Once inside the body, the bacteria multiply and release a toxin called tetanospasmin. This toxin interferes with normal nerve signals and causes muscle stiffness and spasms. Symptoms of tetanus. Symptoms usually appear between 3 to 21 days after infection, most often around 8 days. The early symptoms are mild but gradually become severe. Common symptoms include stiffness in jaw muscles, lockjaw, difficulty swallowing, muscle stiffness in neck and abdomen, painful body spasms, fever and sweating, rapid heartbeat, high blood pressure. In severe cases, spasms can be strong enough to cause broken bones or breathing difficulties, which can be life-threatening. Types of tetanus. There are several forms of tetanus depending on how it affects the body. Generalized tetanus, the most common type, affecting the whole body with severe muscle spasms. Localized tetanus, muscle stiffness occurs near the wound area only. Cephalic tetanus, rare form affecting head muscles, often after head injuries. Neonatal tetanus, occurs in newborn babies due to unhygienic birth conditions, especially when the umbilical cord is cut with unclean tools. Risk factors. Certain conditions increase the risk of tetanus infection. Not being vaccinated. Living in areas with poor sanitation. Having untreated wounds. Using contaminated instruments in medical or birth procedures. Outdoor occupations like farming or construction. People who have not received booster shots are at higher risk. Diagnosis and treatment. Doctors usually diagnose tetanus based on symptoms and medical history rather than lab tests. Early treatment is very important. Treatment may include cleaning and removing infected tissue from the wound. Tetanus antitoxin injection to neutralize toxins. Antibiotics to kill bacteria. Muscle relaxants to control spasms. Supportive care like breathing assistance. Even with treatment, severe tetanus can be fatal, which is why prevention is very important. Prevention of tetanus. Tetanus is one of the most preventable diseases through vaccination. Key prevention methods. Receiving tetanus vaccine, DTP, DTaP, or TD booster. Getting booster shots every 10 years. Cleaning wounds immediately. Using sterile tools in medical and birth procedures. Practicing proper hygiene. Vaccination protects the body by helping it produce antibodies against the toxin. Complications of tetanus. If untreated, tetanus can lead to serious complications such as breathing failure, bone fractures due to spasms, pneumonia, heart rhythm problems, death. Neonatal tetanus has a very high mortality rate if not treated quickly. Conclusion. Tetanus is a dangerous but preventable disease caused by bacterial toxins that attack the nervous system. It leads to painful muscle stiffness and spasms that can become life-threatening. Although treatment is available, prevention through vaccination and proper wound care remains the most effective way to protect against tetanus. Public awareness, hygiene, and immunization programs play a crucial role in reducing the number of cases worldwide.